एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। गाइस, आज की वीडियो में हम बात कर रहे हैं असेंडिंग ट्रैक्स की। ऑन एंटरिंग द स्पाइनल कॉर्ड, द स्पाइनल नर्व फाइबर ऑफ डिफरेंट साइजेस एंड फंक्शंस आर सॉर्ट आउट एंड segregated into the tracts. And now we are talking about these bundles of the ascending fibers are referred to as ascending tracts. The ascending tracts conduct two types of afferent information which may or may not reach the consciousness. The exteroceptive information originate from outside the body, such as others and anatomical organization. The general information about the peripheral end is conducted through and by the series, and it is the simplest form. Ascending pathway to consciousness consists of these. First is first order, which is posterior root ganglion and peripheral process connect, and whereas the central process through the posterior root. Second one is second order neuron, and it has its own root, and third one is third order neuron and it has its own root. Now we will talk about the functions. Painful and thermal sensation ascent in the lateral spinothalamic tract. Crude ascent in anterior spinothalamic tract. Discriminative touch, that is the ability to localize accurately the area of body touched and also be aware that two points are touched simultaneously even though they are close together. 2 points discrimination. Ascent in posterior white column. Also ascending in the posterior white column is information from muscles and joint penetrating to movement and position of different parts of body. In addition, vibratory sensation ascend in the posterior white column. Unconscious information from muscles, joint, the skin and subcutaneous tissue reach the by the way of anterior and posterior spinocerebellar tract, that may cunocerebral tract, and here is spiroreticular tract. Provide a pathway from muscle joint and skin to reticular formation, while the spino-olivary tract provide an indirect pathway for further afferent information to reach. The pain and the thermal receptor in the skin and other tissues are also travel here. And now we are talking about the main somatosensory pathways to consciousness and their nerve endings. When we talking about first order neuron, it is posterior root ganglion. Second order is also posterior root, and second one is substantia gelatinosa for all, but in the last one the second order is nuclei gracilis and cuneatus. In the form of third order, there is ventral posterior lateral nucleus of thymus and ventral posterior lateral nucleus of thalamus, and last one is also same. When we talk about their pathways, then first one has the pathway of lateral spinothalamic spinal lemniscus. Second one has anterior spinothalamic spinal lemniscus, and third one has fasciculus gracilis and cuneatus medial lemniscus. Destination are also different. Posterior central gyrus, as well as last one also has posterior central gyrus. So if you have any query regarding the main somatosensory pathway to consciousness, you can ask me in the comment section. Thank you so much for watching the video.